Hi, I'm Dr. Rhea Hogseth, founder and director of the Pediatric Dental Assistants Association. When we're doing restorative dentistry, one of the key things that we are trying to achieve is great isolation. A wonderful way to do that is by utilizing a rubber dam. So today I'm going to give you a couple quick tips on how to make that hole punching for your rubber dams much quicker and easier for your whole dental team. So whether you're utilizing a 5x5 rubber dam or 6x6, this works the same. Some people like the 5x5 for more the primary dentition and the 6x6 for the permanent dentition. You can even use color coding. So if it's a primary tooth, you could use a blue rubber dam, and if it's a permanent tooth, you can use a green rubber dam. Whatever works best for your office. But what I want you to do is envision a square in the middle of the rubber dam. For the primary dentition, you want this to be about 1 inch square and 1.5 inches for the permanent dentition. As a general rule of thumb, pun intended, your first joint of your thumb is about 1 inch. From the tip of your thumb to the first joint is 1 inch, which will aid you in that measurement. So each of these corners is going to be where you would punch the holes for the molar clamp. So we're going to make it be in a T shape. So envision that same square, and you're going to hole punch 2 holes in a quadrant for your primary molar clamp. This will aid you in getting the rubber dam over it without tearing the rubber dam and having to start back over. Then if you're doing a quadrant, you would go ahead and extend 2 more holes for that quadrant to enable you to isolate that whole quadrant. You can make these holes going forward smaller, utilizing a smaller hole on the hole punch if you like. You could also have them not touching each other if you like to have rubber dam material in between that you can floss and help with your isolation. It's entirely up to you whether you use a T shape that's connected for a whole quadrant, or if you just do the molar 2 holes connected and then spread out the other holes, whatever you like to do. So by punching this in one quadrant, it can be used throughout the whole mouth. This punch would be for the upper right. You could use it for the upper left. You could flip it for the lower left and flip it for the lower right. So some people would like to go ahead and punch the holes and have it on a frame and have that set up with your individual trays. Or you might have it in your individual treatment operatories and set it up then as the patient comes in. Whichever way you work in your office does fine this way, utilizing that T-shape. Now some people might think about utilizing the T-shape with it right down the middle, and then your staff does not have to figure out which quadrant it's in. There is just one problem with that, in that if it's down the middle and you have to move the rubber dam over to a quadrant, then you're opening up part of the mouth so that you get more ambient air if you're trying to use nitrous oxide. If it is indeed in a quadrant, then when you put it in, you've got it covered for the whole mouth. So it's something to consider going ahead and punching it in a quadrant and letting your staff just figure that out. So then for the permanent dentition, what you're going to want to do is 3 holes. So you're going to do 3 for the molar clamp. It's larger, and again, you don't want it to split the dam as you're putting it in. So if you're just doing the molar by itself, you could do 2 or 3 holes, depending on how you like it. But if you're doing a whole isolating of a quadrant, again, I use 3 holes because it's doing my permanent molar, primary second molar, primary first molar, and going all the way up to the cuspid. But however you normally like to isolate is going to work for you. So you can also, again, make those holes smaller as you're going more anterior because the teeth are smaller. You can also spread out the holes if you like to have rubber dam material in between your teeth so that you can isolate a little bit better. Entirely up to you is how you want to do that. The key is just to put it in a quadrant, pre-punch them, and just utilize the same ones for every single time, and you will have a fast, easy, efficient way to punch your rubber dams. I urge you to enroll today to get immediate access to tips like this and many, many more in our over 100 modules. I'm Dr. Rhea Hogseth, founder and director of the Pediatric Dental Assistants Association. I'll see you on the next Practice Pearl from the PDAA.